So today our topic is the posterior triangle of the neck, but today I would like to start with my lecture first of all with a small quotation which may boost up you. Challenges are what make life interesting. Overcoming them is what makes life meaningful. ये अभी जो चैलेंज है आप लोगों के लिए वो लाइफ में सच में आपके लिए चैलेंज है. I hope you will overcome them and it will make your life meaningful. So coming to the lectures, today's lecture. So today's lecture is the posterior triangle of the neck. We will see first of all, if we will see the side of the neck, I told you the side of the neck is somewhat quadrilateral in shape. See, so this is the shape of the side of neck. So this is almost quadrilateral in shape. Okay? Now this side of the neck is divisible into two parts by the very important muscle that is known as sternocleidomastoid muscle. This one. So this is the sternocleidomastoid muscle. This muscle divides the side of the neck into the two parts, the anterior triangle and the posterior triangle. So the part of this neck in front of the sternocleidomastoid is the anterior triangle, and the part of the side neck behind this is known as the posterior triangle. Now today our topic is the only posterior triangle of the neck. So beginning with the posterior triangle of the neck, we will first see the most important muscles of the neck, that is the sternocleidomastoid and trapezius. Trapezius you already have studied in the upper limb. Now today I will see first of all the sternocleidomastoid muscle. So here also you can see the sternocleidomastoid. So this is the anterior median line, okay, and we have the posterior line. So this is the anterior triangle and this is the posterior triangle. So you can see this is the posterior triangle and this is the anterior triangle. Okay, then we will see the sternocleidomastoid muscle first of all. So it is a key muscle of the neck. So क्यों इसको key muscle कहते हैं? क्योंकि this is the muscle which divides the various triangles in the neck. So it is the muscle which divides the side of the neck into anterior triangle and the posterior triangle. Now we will see the origin and insertion of this muscle. The muscle originates by the two heads, the sternal head. This is the sternal head. Also this is the sternal head and this is the clavicular head. So they arise by the two heads. यहाँ पे भी आप देख सकते हो, it originates by the two heads, the sternal head that arises from the sternum and the clavicular head that arises from the clavicle. Now the sternal head, it is a tendinous, आप देख सकते हो tendon like है इसकी origin, and it arises by a round tendon from the superolateral part of the front of the manubrium sterni. So this is the superior lateral part of the front of the manubrium sterni. So it originates by the tendinous structure from the superolateral aspect of the manubrium sterni, and then passes upwards. It goes then upwards and backwards and laterally in front of the sternoclavicular joint. So it arises from here, goes upwards and backwards in front of the sternoclavicular joint. Now we have the clavicular head. It is a flat, it arises as a flat. Here you can see this is a flat musculo-aponeurotic, okay, as a flat musculo-aponeurotic. It arises from the medial third of the superior surface of the clavicle. यहाँ पे भी देख सकते हो, it is a flat and musculotendinous, arises from the medial 1/3 of the clavicle. Then it also passes vertically upward. It goes vertically upward deep to the sternal head, which then it unites with the sternal head and joint form the fusiform valley. So this is the fusiform valley. So when the two heads arises from sternal and clavicular head, they join together to form the single belly and get inserted on the as a thick tendon on the lateral surface of the mastoid process. यहाँ पे mastoid process है, ठीक है, and at the base, from its tip to its base, and by a thin aponeurotic into the lateral half of the superior knuckle line or occipital bone. So this is the mastoid process. so it get inserted from its tip. This is the tip of the mastoid process up to its base. So with the help of thick aponeurosis, it gets inserted on the mastoid process from its tip to its base, and by the thin aponeurosis it gets inserted to the superior knuckle line. This is the superior knuckle line, ठीक है. So यहाँ attach होता है by the thick aponeurosis, और यहाँ पे भी attach होता है with the help of a thin aponeurosis. So we see the, if we see यहाँ पे एक चीज़ और यहाँ पे नोट करने की चीज़ है, there is a gap between the sternal head and the clavicular head. ये छोटी सी गैप यहाँ पे भी देख सकते हो, एक छोटा सा ट्रायंगल बन जाता है. एक छोटी सी गैप होती है between the two heads just above the sternoclavicular joint, और इस गैप को हम कहते हैं lesser supraclavicular fossa. तो दिस इज द लेसर सुप्राक्लेविकुलर फोसा. हमारे पास अभी तक ग्रेटर सुप्राक्लेविकुलर फोसा भी था, ठीक है, था ना, क्योंकि पिछली बार हमने क्लास में पढ़ा था जो मिडिल वन थर्ड ऑफ द क्लेविकल है उसके ऊपर जो इन्वेस्टिंग लेयर था वो बाइफरकेट हो रहा था, तो उसके बीच में ये स्पेस बन रही थी, ये वाली आप मान लो, ये यहाँ डिप, इवन अगर आप क्लेविकल मिडिल क्लेविकल के ऊपर देखोगे ना वहाँ डिप होता है स्किन, तो दैट इज द greater supraclavicular fossa, and this is the lesser supraclavicular fossa which is between the two heads of the sternocleidomastoid. And what are the structures present in this fossa? We have the very important structure, that is the terminal part of the internal jugular vein. यहाँ पे this is the internal jugular vein, ठीक है, तो यहाँ पे terminal part होता है internal jugular vein का, and this is the very important site for the इंसर्शन ऑफ एनी नीडल और कैथेटर. तो अगर हमें नीडल या कैथेटर डालना है इंटरनल जुगुलर वेन में फॉर एनी पर्पस थेरेपेटिक और डायग्नोस्टिक, वी कैन इंसर्ट द नीडल हेयर. सो दिस कैन, क्योंकि यहाँ पे आराम से आप पैल्पेट कर सकते हो, देख सकते हो विद द स्टर्नल हेड एंड द क्लेविकुलर हेड. जब आप नेक साइड में करोगे स्टर्नोक्लेडोमास्टाइड प्रोमिनेंट हो जाती है, तो उसके दो हेड्स भी प्रोमिनेंट हो जाते हैं, और जो आपका ये ट्रायंगल है फोसा है ये बिल्कुल क्लियर होता है, और उस फोसा के अंदर क्या है हमारा टर्मिनल पार्ट ऑफ द इंटरनल जुगुलर वेन, जहां आप कोई नीडल या कैथेटर इंसर्ट कर सकते हो, ठीक है. सो इट इज वेरी इंपॉर्टेंट. नाउ वी विल सी द बाउंड्रीज ऑफ द sternocleidomastoid muscle. The boundaries of this. First of all, we will see the nerves blood supply of the this muscle, because this muscle is very important. We can use this muscle as a reconstructive flap for the various reconstructive surgeries like in the plastic surgeries. अगर फेस में कहीं पे हमें या कहीं नेक पे हमें प्लास्टिक सर्जरी की ज़रूरत होती है, रिकन्स्ट्रक्टिव सर्जरी, जैसे बर्न हुआ है तो आपको मसल की ज़रूरत है, तो हम क्या करते हैं, ये मसल हम यूज़ कर सकते हैं फॉर द रिकन्स्ट्रक्टिव सर्जरी. और ये अगर हम मसल यूज़ कर रहे हैं तो अगर उसकी नर्व सप्लाई ब्लड सप्लाई साथ होती है तो वो मोर वायबल होती है, वो नेक्रोसिस नहीं होती है, ठीक है. तो इसकी ब्लड सप्लाई जानना बहुत इंपॉर्टेंट है, क्योंकि इसकी ब्लड सप्लाई तीन सोर्सेज से आती है. अपर थर्ड से अलग आती है, मिडिल वन से अलग आती है, लोअर वन थर्ड से अलग आती है. तो अपर पार्ट रिसीव्स द ब्लड सप्लाई फ्रॉम द ऑक्सीपिटल आर्टरी एंड द पोस्टीरियर ऑरिकुलर आर्टरी, and middle part receives the blood supply from superior thyroid artery, and lower part receives the blood supply by the suprascapular artery. So the knowledge of this arterial supply is very important in order to make the muscle flap in reconstructive surgeries, ठीक है. Now the nerve supply of this muscle, it is supplied by the spinal root of accessory nerve. ये जो दोनों जो हमारी मसल इंपॉर्टेंट मसल्स हैं साइड ऑफ द नेक, दैट इज दिस SCM and the trapezius. Both these muscles are supplied by the one single nerve, that is the, और वो नर्व खाली इन्हीं दो मसल्स को सप्लाई करती है. वो कौन सी है? दैट इज द स्पाइनल रूट ऑफ द एक्सेसरी नर्व, ठीक है. So that is the motor nerve. It is also supplied by the C2 and C3, which is sensory, and also carry the proprioceptive sensation from this muscle, ठीक है. Now the action are when the muscle contracts, it tilts the head towards the shoulder on the same side, ठीक है, and rotates the head so that the chin turns the opposite side. जब आप opposite side से लेते हो ना chin को, तो ये muscle कौन सी contract होती है? दूसरी side की. अगर आप we will see the action of the sternocleidomastoid. If it acts together, when the muscle contracts, it tilts the head towards the shoulder on the same side and rotates the head to the and the chin towards the opposite side. So this movement occurs during an upward sideways glance. When the muscle of the both sides contract together, they draw the head forward. ठीक है, एज इन लिफ्टिंग द हेड फ्रॉम द पिलो. जब आप सोए होते हैं तब आप जब हेड उठाते हो तो मसल्स जो होती है दोनों स्टर्नोक्लेडोमास्टाइड इकट्ठे एक्शन में आती है. So the two sternocleidomastoid, it also act as an accessory muscle of respiration during forced inspiration. Now we will come, and one of the clinical correlation with it is that torticollis or wry neck. ठीक है, what is wry? W-R-Y, wry neck and or torticollis. It is a clinical condition in which the head is bent to one side. आपने देखा होगा ना अक्सर, तो गर्दन एक ही साइड की, एक साइड से ही जाती है और चिन अपोजिट साइड से होती है ना, टेढ़ी गर्दन होती है उसमें. So that occurs due to the spasm of the sternocleidomastoid and the trapezius, because they are both supplied by the same nerve. The spasmodic torticollis is characterized by repeat painful contraction of the trapezius and sternocleidomastoid. So it may occur due to the spasmatic contractions of these two muscles, and these contractions usually occurs due to the exposure of cold or maladjustment of pillow during sleep. The another type is the reflex torticles. It occurs due to the irritation of the spinal accessory nerve that is caused by any inflammation or respiratory lymph nodes. Okay, that is the reflex one. The third one is the congenital torticollis. It is due to the birth injury to the muscle. Permanent torticollis may occur due to the subsequent ischemic contractures. So we have three types of torticollis: spasmodic, reflex, and congenital. Now now the sternocleidomastoids, you can see it is crossed by the, I told you the last time, it is crossed by the superficially by the greater auricular nerve, external jugular vein, and the transverse cervical nerve. The deeper aspect, we have the different structures, we will not go through that. Now we will start with the posterior triangle, the boundaries of the posterior triangle. The posterior triangle it is a triangular in shape. The apex is directed upwards and the base is directed downwards. The anterior triangle is formed by the posterior border of, so this is the picture. So this is the posterior triangle. It is formed, the apex is upwards. Now the borders of the posterior triangle are: anteriorly we have the posterior border of sternocleidomastoid, posteriorly we have the anterior border of the trapezius muscle, and the base is formed by the middle third of the clavicle, and the apex is upwards, which is formed by the joining of the sternocleidomastoid and trapezius muscle at the superior knuckle line of occipital bone. तो ये है apex, this is anterior border, this is the posterior border, and this is the base. Now the roof is formed by the investing layer of the deep cervical fascia. ये मैंने पिछली बार भी बताया था. तो हमें क्या पहले है, रूफ से पहले हमें स्किन है, स्किन के बाद सुपरफिशियल फेशिया है, उसमें हमारी प्लेटिस्मा मसल है और हमारी एक्सटर्नल जुगुलर वेन है और क्यूटनस नर्व्स है. देन वी हैव द इन्वेस्टिंग लेयर ऑफ द डीप फेशिया. ठीक है, सो दैट फॉर्म्स द रूफ ऑफ द this triangle, posterior triangle. And then we have the floor. The floor is formed by the muscles, various muscles. If we go from above to downward, we have the different muscles. Here you can see this is the posterior triangle. इसमें देख सकते हो. Now roof, अगर हम जाएंगे outside to inverse, we have the skin, superficial fascia, platysma, investing layer of deep cervical fascia. Platysma has the lower and the anterior, forms the lower and the anterior part of the roof, and the investing layer of deep cervical fascia is pierced by the cutaneous branch of cervical plexus and external jugular vein, जो मैंने आपको बोला. ये ठीक है. We have the cutaneous nerves here, we have the external jugular vein, we have the investing layer of the deep cervical fascia. Now floor is formed by the prevertebral layer of the deep cervical fascia, which covers these muscles. From above downward we have this one. This is the semispinalis capitis number 2. ठीक है. Third one is splenius capitis. Fourth is levator scapulae. Fifth is sclenus medius and sixth is sclenius anterior. ठीक है. So these muscles from above downward, semispinalis capitis, splenius capitis, levator scapulae, sclenius medius, sclenius anterior. ठीक है. ये सारी muscles and these all the muscles are covered by which fascia? Prevertebral fascia, and it forms the floor of this triangle. Now we have divided the posterior triangle have been divided into the two parts by the inferior belly of the omohyoid. यहाँ आप देख सकते हो, this is the omohyoid muscle. Omohyoid muscle have the superior belly and inferior belly and intermediate tendon. The inferior belly of this omohyoid muscle divides the posterior triangle into the upper larger triangle that is known as the occipital triangle and the smaller triangle that is known as the supraclavicular triangle. Why they are known as occipital triangle and supraclavicular triangle? Because of the presence of the occipital artery in occipital triangle and supraclavicular artery in the supraclavicular triangle. ठीक है, इसलिए इनका नाम दिया गया है. Now we will see the different and the contents that are present separately. We see the separate contents in both the triangles. Now we will see first of all the occipital triangle. It has the anterior border by the posterior. Anterior border is formed by the posterior border of the sternocleidomastide. Posteriorly we have the anterior border of the trapezius muscle. The apex is formed by the union of these two muscles and base is formed by the inferior belly of the omohyoid muscle. And what are the contents in this triangle? We have the most important nerve is present in this triangle, that is the spinal root of accessory nerve. ठीक है. So this is the occipital triangle. ये dotted दिख रहा है आपको. ठीक है. तो इसमें important structure होती है हमारी, सबसे important होती है spinal root of accessory nerve, which emerges from the posterior middle part of the posterior border of this muscle. So इसके middle part होता है, वहाँ से emerge होती है और it crosses the posterior triangle just parallel to the muscles of the levator scapulae and just 4 to 5 centimeter above the clavicle it goes just deep to the trapezius muscle and supply that muscle. ठीक है. यहाँ से निकल के जैसे क्रॉस करती है और जाती है trapezius के नीचे. Then we have the third and fourth cervical nerves that provides the branch to the levator scapulae and trapezius muscle. ठीक है. Then we have the dorsal scapular nerve. We have the four cutaneous nerves, which is greater auricular. This is the greater auricular. We have lesser occipital. We have transverse cervical. We have supraclavicular. These cutaneous nerves are also the contents of occipital triangle. And the important artery, we have the occipital artery here and the superficial transverse cervical artery. ठीक है, ये आपको मैंने बताया. These are the contents: spinal part of accessory nerve, four cutaneous branches, that is lesser occipital, greater auricular, anterior cutaneous nerve, supraclavicular nerve, and muscular branches is to muscle for the muscle levator scapulae and trapezius, and for the nerve to rhomboides, and upper part of the brachial plexus only. Here you can see, this is the picture. यहाँ पे देख सकते हो. यहाँ पे देख सकते हो वी हैव द कंटेंट्स. यहाँ पे जो है सबसे मोटी जो नर्व्स होती है इसमें स्पाइनल जो निकलती है स्टर्नोक्लेडोमेस्टाइड के पीछे से, दिस इज द स्पाइनल रूट ऑफ एक्सेसरी नर्व और क्रॉस करके फिर जाती है पीछे ट्रेपेजियस. इसी के साथ हमारी मस्कुलर ब्रांच होती है लेवेटर स्कैपुला की होती है, हमारी डॉर्सल स्कैपुलर नर्व होती है, ट्रेपेजियस की C3 C4 होती है. दिस इज द ट्रांसवर्स सर्वाइकल आर्टरी. ठीक है. एंड हियर वी हैव द ऑक्सीपिटल आर्टरी. तो याद रहा. और वी हैव द क्यूटनेस ब्रांचेस. Now we will see the contents of the supraclavicular triangle, which is also known as the subclavian triangle, क्योंकि वहाँ पे important structure subclavian artery होती है. So what it lies below the omohyoid. So इसकी boundaries क्या होगी? मैंने आपको बताया. सो यहाँ पे हमारी ये है सुप्राक्लेविकुलर. तो above we have omohyoid, inferior belly of omohyoid, posteriorly we have trapezius, anteriorly we have sternocladomestide, and inferiorly we have the clavicle. Now the contents are, the most important is the third part of the subclavian artery. यहाँ देख सकते हो, we have the third part of the subclavian artery, we have subclavian vein, we have the terminal part of the external jugular vein, we have trunks of brachial plexus, which is very important structure present here. तो important क्या है इसमें से, subclavian artery है, subclavian vein है, brachial plexus है, trunks of the brachial plexus, ठीक है, and we have the terminal part of the external jugular vein. And we have the superficial and superficial cervical और suprascapular arteries. ये देख सकते हो यहाँ पे ये suprascapular arteries होती है, and some lymph nodes. ठीक है, lymph nodes हमें ऊपर भी होती है, नीचे भी होती है. ठीक है. Now the most important content of posterior triangle are the third part of subclavian artery, brachial plexus, spinal accessory nerve, and the lymph nodes. All the important contents of this posterior triangle just lie deep to the facial carpet. ठीक है, जो fascia होता है ना, investing layer of the deep, उसके नीचे होती है, except the spinal root of accessory nerve, which is present in the tunnel which is formed by the fascia itself. जो fascia के अंदर ही एक tunnel होती है जिसके अंदर हमारी ये important nerve होती है. So in case of any operation in the posterior triangle, all the structures except the spinal accessory nerve are safe, provided the facial carpet of posterior triangle is left intact. तो हमें यहाँ पे फिर during the surgery ख्याल रखना है कि fascia में हमारी spinal root of accessory nerve होती है. ठीक है, तो हमें उसको intact ही रखना है. Now this is all for today's class. We will see first of all we will see some of the brachial plexus block यहाँ पे दिया जाता है. ठीक है, in the posterior triangle. तो क्योंकि यहाँ पे हमारा brachial plexus होता है, we can pulsate the subclavian artery here. We have the different swellings present in the posterior triangle, and the most important is the enlargement of the lymph nodes due to the Hodgkin's disease or any other malignant tumor. The left supraclavicular lymph node, जो यहाँ पे supraclavicular lymph nodes होते हैं ना, उसको हम दूसरा नाम कहते हैं Virchow's lymph node, because it is commonly associated with the metastasis from cancer tumor, cancer of stomach, cancer of testes, or cancer of any other abdominal organ. And the biopsy of these lymph nodes is helpful in early diagnosis and distant malignancy. So we have very important tumor, we have very important lymph node here, which is enlarged in malignancy like in CA stomach. That is known as the Virchow's node. Okay, that is important. Thank you so much for today.